I think it's time for us to start today's session. Yesterday, we had extensive discussions on elimination of hepatitis C. Today, we are going to talk on hepatitis B elimination. And we have about 5-6 speakers. And the first one, which is going to be spoken about, is hepatitis B elimination program in Turkey. This will be spoken to by Professor Abdulkadir, who is also my co-chair, and he's an emeritus professor at the Ankara University and has been the past president of Apasl. So everyone knows about him. So welcome, Professor Kadir, for your talk.
Thank you very much. First of all, I would like to thank Professor Erkin and Professor Gulnara inviting me. Very beautiful country and very beautiful city, Tashkent. And today I'm going to talk about hepatitis B elimination program in Turkey. Actually, in Turkey, hepatitis B positivity almost 3 or 4%, and anti-HBC total 30%, HBs positivity more than 2 million people in the adult age group, and also hepatitis B cause 30 or 40% of cirrhotic cases and 40 or 50% of hepatocellular carcinoma. And also hepatitis B cause 50% of liver transplantation or chronic hepatic failure. And still in Turkey, we have 12% of carriers are aware of this situation. As you know, WHO declared and says the targets of the elimination viral hepatitis is a public health risky by 2030. According to this declaration, the reduction in the risk of new infection 90%, reduction in the number of hepatitis B patients that can be treated 80%, reduction in hepatitis-related mortality 65%, and also to reach undiagnosed patients actually eligible, treatable 88%. What happened in Turkey? After this declaration, Turkish government National Strategy Prevention and Control Program covering 2018-2023 to reach goals to WHO's targets. Then after that, we made a roadmaps projects were carried out for prevention of hepatitis B together with hepatitis associations. I'm going to mention about later. What is the aims of Turkish viral hepatitis prevention and control program for hepatitis B virus? Actually, there are very important points to raise awareness through Turkish society, particularly among those groups who are most at risk, and intention of preventing disease transmission, and to cover whole Turkey with vaccination, and we have to make an early diagnosis and appropriate guidance for the treatment plans to be prevention of cirrhosis and liver cancer. Actually, of course, very important socioeconomic impact of the hepatitis B virus. Then later, Coalition for Global Hepatitis Elimination made a report for Turkey, and in that report, persons living with hepatitis B diagnosed almost 50%, and diagnosed person receiving appropriate treatment less than 30%. And hepatitis B new vaccination coverage of hepatitis B birth dose almost 99%, and hepatitis B related death rate almost 6 as a per 100,000. As you can see here, after 4 years, Turkish viral hepatitis prevention and control program again evaluated. And according to this evaluation, the current station almost completed 42% and ongoing 46%, but still there's nothing to do on 15%. And there are 3 main hepatology associations in Turkey. One is the Turkish hepatopancreatibiliary associations, viral hepatitis associations, and Turkish Association for the Study of the Liver. Then we are going together, working together with all these 3 associations and also with the government. And we made a Turkish guideline for the treatment of HCV and updated 2019. And also we evaluated and we recommend to the government National Hepatitis B Elimination Roadmap. According to this roadmap, we have 5 stages, very important. One is the review of the current hepatitis B strategies and plans. The second, conducting preliminary interviews, conducting the workshops, preparation of the hepatitis B elimination roadmap with the scope of the National Hepatitis Elimination Program, and evaluation for National Hepatitis B Elimination Roadmap project. According to this roadmap, we also recommend to the government preparation, awareness, and screening, firstly by healthcare associated professionals, and face-to-face training activities, learning efficacy after the training sessions, integration of the obligatory follow-up, and screening in all individuals above the age of 18 and in younger high-risk individuals, and also collection of the accurate and reliable surveillance data, collection of the screening data, and finally, having an electronic identity card. These are very important recommendations, and the government really strictly obeyed these recommendations. And what are the basic factors of Turkish National Hepatitis B Elimination Roadmap? Of course, the raising awareness, very, very important. In Turkey, especially in rural area, people has no any idea about hepatitis B. That's why we have to educate and we have to make awareness in the people. Just 10 years ago, one article published for the public awareness of the hepatitis B infection in Turkey, and as you can see, the awareness very low, and also they concluded that promoting better awareness of the HPV and endorsing mass educational intervention may be useful strategies to prevent the spread of the hepatitis B infection. Then, of course, the activities very important for the training and raising awareness of the prevent hepatitis B viral infection. What can we do? The viral hepatitis educator guide and educational slide sets were prepared and shared by the Minister of Health in 2022. Family physicians have been training regularly. Meetings were organized in various provinces to raise public awareness of the hepatitis among the public, and posters were posted in billboards. The National Home Villages Guide for safe blood transfusion was updated in 2022. The perception of if the patient is a carrier, nothing is needed, should be changed by regular training. What can we do for the increasing screening and surveillance program? As you can see here, all these recommendations, such as all voluntary blood donations for hepatitis B since 1993, all registered sex workers are tested for hepatitis B every 3 months. And also the couples who appeal to marriage since 2002, all the couples are tested. And antenatal screening for hepatitis S antigen among pregnant women is not mandatory. Advertisement on visual and written media and also training programs for the physicians were implemented. A series of face-to-face training, many sessions we do and will be organized with the participation of family physicians. Family physicians are very important because family physicians directly face-to-face counter with the patients. And also screening and training of personnel working in hospitals should be obligated because the health workers are very important for the screening and also for the surveillance. And also, actually, absolute screening of adult is recommended in regions with as a prevalence of more than 0.1%. Surveillance data should be collected and handled by the Ministry of Health and used in national health policy making. Hepatitis B screening data collecting activities should be centralized and confirmed carrier status could be transmitted to relevant professionals and institutions. And finally, an electronic identity card specific to the prevention of hepatitis B could be designed, and also the government made this decision. How about the regional differences in Turkey regarding with notification? This is a very important point because especially in western region of Turkey, the people very notified, but in eastern part is not so good. That's why residents of eastern, particularly southeastern Anatolia, have high rates of hepatitis S antigen positivity. One meta-analysis showed that from 1990 and 2009, high rates in eastern parts of Turkey. Of course, for this program, reducing viral transmission is one of the most important points. And four of them are very important. Providing safe blood products, prevention of viral hepatitis transmission among people who inject or use drug, prevention of healthcare-associated transmission, and finally, control of vertical transmission. In Turkey, especially control of vertical transmission are very considered. And actually, 90% of cases of chronic hepatitis B infection transmitted during the perinatal period. This is the fact. That's why we have to make very strict control of the vertical transmission. How? Ensuring hospital delivery. This is very high in Western Turkey, but low Eastern Turkey. Rigorous prenatal counseling, standard management protocols, and HPV vaccine and immunoglobulin to high-risk babies at the time of birth. Almost we reached these babies almost 98%. How about the increasing immunization? We started National Immunization Program 1998, and first dose at the second month after birth in this period. But at birth, since 2003, we started immediately in 24 hours. And complete dose at birth, 4 months and 6 months, first month and also 6 months. Of course, sometimes we can, there are some escape. That's why we can make a catch-up vaccination, especially in primary school between 2005 and 2009 born people and high-risk adults. Vaccination is the most efficacious way to prevent hepatitis B virus, as you know. Turkey vaccination rate has increased from 64% in 1990% and also 98% in 2016. Catch-up vaccination was administered to those who were in first of middle school between 2005 and 2009. Theoretically, most people born in 1991 or later have completed their primary vaccination. Vaccination of newborn in the first 24 hours must be vaccinated because sometimes in rural area, pregnant people don't go to hospital and they deliver in their houses. That's why family doctors are very, very important to collect all these pregnant people. And also HBs antigen positive mothers must be vaccinated and also immunoglobulin within 12 hours. Mother, if the mother HBs antigen negative and newborn weight less than 2 kilograms, the first dose of vaccine might be in 1 month. Mother, if mother hepatitis B antigen positive, vaccine plus immunoglobulin must be implanted within 12 hours. If the mother HBs negative, so we don't need testing for infants. How about the vaccination status among healthcare students? There's one study published 2021, and in this study, they concluded that public health activities to control HPV infection have increased in the last 3 decades. And HPV vaccination rates among university students in the healthcare was high, but lower than the country targets. Susceptible students should be vaccinated against hepatitis B virus. And as you can see here, the vaccination free of charge, all these groups. What happened in from 1995 to 2015? As you can see here, hepatitis B as antigen positivity rate decreasing from 5.3% to 3%. And actually, in these periods also, acute hepatitis B incidence really gradually decreasing. Finally, increasing access to treatment is very, very important. Current trends, once daily oral entecavir, TDF and TAF can suppress HBV DNA profoundly, but have no direct action on cccDNA of the HPV-infected hepatocytes. In HPV-infected patients with certain characteristics, treatment should be started without liver biopsy. The long-term goal of antiviral therapy has partially achieved by effectively reducing the incidence of hepatocellular carcinoma development. Existing antiviral therapy is still far from satisfactory now that new strategies and or new drugs are emerging. And as you can see here, if the instance will be decreased, then widespread vaccine use in high-risk groups must be increased, high-risk behavior decreased, and also effectiveness of antiviral drugs must be increased. So we can say development of the liver cirrhosis and hepatocellular carcinoma can be decreased, and requiring the liver transplantation for advanced hepatitis B decreased. As a conclusion, the Turkish viral hepatitis prevention and control program were announced by the Minister of Health in 2018. After evaluation of the current status in 2020, the National Hepatitis B Elimination Roadmap was created in cooperation with hepatology associations in 2022. National immunization program was started 1998. The actual rate of 3 doses of hepatitis B virus vaccination in infants reached to 98%. Vaccination is free of charge to newborn and high-risk groups. And finally, also the government covers for the treatment of hepatitis B infection in Turkey. I would like to invite you to Apasl Annual Congress will be held in Istanbul in April, and I believe that this Congress will be very, very attractive for the people. Thank you very much for your attention.
Thank you, Dr. Abdulkadir.
Would you like to?
Yes. Yeah.